Good afternoon. I'd like to call to order the April meeting of the Delaware County Juvenile Detention Board of Managers. If we could all rise for the Pledge of Allegiance. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Joining us remotely from the board today is Shakima Fulmore Townsend. Shakima, can you confirm you hear us okay?
I hear you all just fine. It's pretty good. Good one.
Wonderful. Other housekeeping items, per usual, we did have an executive session yesterday to cover real estate and public safety matters. And with that, we'll move on to our first round of public comment. If there are members of the public who would like to address the board, you have two opportunities as always. The first round would be regarding items specifically on the agenda for today. And the second round at the end can be matters more generally about detention in Delaware County. If there are any members of the public who would like to speak at this point, please come to the mic. You have 3 minutes as always, and please give your name and your municipality to start. Are there any members of the public who would like to speak at this point? Hearing none, we'll move on to the approval of minutes from last month's meeting. Is there a motion to approve?
So moved.
Second.
We have a motion and a second. Any questions or comments on the minutes? Hearing none, all in favor? Aye.
Aye.
Any opposed? The ayes have it. With that, we'll move on to our monthly report on detained youth from Juvenile Court and Probation Services.
Good afternoon, everybody. Kirsten Keenan here for Juvenile Probation. We currently have 3 male youth in detention centers. We have 1 in Chester County, 1 at Abraxas, and 1 in George Jr. The 1 at George Jr. is a direct file youth. We have 1 direct file youth male who's at Delaware County Prison. And then we also have 1 female youth who is a direct file who is at SCI Muncie.
Okay, so again, in total, there are 5, 3 of which are direct files.
Yes.
1 is at George Jr., 1 is at George W. Hill, and 1 is at SCI Muncie.
That is correct.
Okay. Any questions for Ms. Fitzsimmons? Okay. Thank you.
Thank you.
Moving on to the report from our superintendent, Mr. Azari.
Good evening, board, and thank you. We had the opportunity at our last meeting to present a scope of work from the National Assessment Center Association with involving the planning of Delaware County's first ever juvenile assessment center. At the board's request, they wanted some time to be debriefed and study the model. Again, with us today, we have the interim executive director of the NAC, Ms. Carly Keeter, who's going to give us a presentation on the NAC, and I would like to move forward with voting on that scope so we continue our planning process. So without further ado, Ms. Carly Keeter, also joined from our senior Stoneleigh Fellow through the National Assessment Center, Ms. Anne-Marie Ambrose. The floor is yours, Ms. Keeter.
Thank you so much. I'm actually going to ask Annie to begin because she has so much of the history in terms of how this work has evolved in Delaware County and how that relates to the proposal.
Yeah, really briefly, thanks, Carly. This is just a reminder to all of you. The board has been very patient and sort of hearing some of the planning that has been occurring over the last couple of years. And I've been involved officially. It was a year, March 6th. But my fellowship is actually housed at the National Assessment Center. You'll recall that Molly Barker, who is the executive director currently on maternity leave, gave a presentation to this board in March and explained some of the planning that we anticipated moving forward. When we presented the results from the CCLP assessment, the NAC was really highlighted in those recommendations. And that really is focused on the 5 areas where most of our kids are coming from, the data that we saw, the data that showed that so many of them are low-level offenses, the data that showed the opportunity in partnering with community, as well as just the community participation that you all have seen over the last year and a half, maybe even longer. Community members who are interested in young people, community members who are interested in participating in the process. And so NAC's involvement and what the proposal anticipates is really partnering with community in those 5 areas, looking at what assets currently exist, and then working with community members in identifying additional assets that could exist as alternatives to detention, as prevention opportunities, really kind of lifting up the voices of young people and community in ways that allow us to create what I call hubs of services. And that would be, it could look different in each of the 5 communities. It would depend on the process that we use through NAC's planning around engaging the community in a conversation about what services would be helpful in preventing kids from coming to the attention of law enforcement. So really engaging schools in a big way, engaging families in a big way, and thinking differently about what happens to all kids in that community. So it could be kids who are at risk for child abuse and neglect. It could be kids who are at risk for delinquent involvement. It could be kids who are just having some difficulties in school and need some support. It's going to look different in different ways. And Carly is going to go through sort of the process that NAC engages in, but also where it's worked in other places that are similar to what's happening in Delaware County. I think the unique opportunity that I've talked to you all about is that Delaware County is at a really important point in defining where we go from here and really using community voice to help lead whatever that planning looks like. We don't have that many kids who require, as you can see from the monthly report outs, 5 kids right now need sort of a secure level. The other kids need something else, and really working with community and defining what that's going to look like. We have the benefit of working with the Office of Juvenile Justice and Delinquency Prevention at the federal level. PCCD has gotten a grant from OJJDP. Dave Irizarry and myself have talked to Mike Pennington at PCCD about how Delaware County can fit into that grant process. So there's tremendous opportunity at the state level and at the federal level, because the things that we have talked about doing in Delaware County based on the assessment are very consistent with the vision that both Pennsylvania and the federal government have. So for what should be happening with engaging community and really preventing young people from going into the juvenile justice when there are alternatives to detention and to juvenile justice involvement. So that's just my quick sort of context setting for all of you. And I will turn it over to Carly to present some of the specifics of the great work that NAC has been doing nationally.
Thank you so much. And if it's possible, I have a few slides that I'm just going to share and walk us through. This is a very abbreviated version of a training that really provides a much more comprehensive overview of what an assessment center is, how, and really provides very concrete examples of how different communities across the country have really operationalized the model of an assessment center in different ways to suit the kind of community needs that have been identified. So very briefly, the goals of an assessment center are prevention of delinquency, so very upstream, or prevention of further delinquency, really to serve that role that Annie just talked about in terms of comprehensive services, really serving as that hub of access to resources that exist in the community for youth and their families, but also really serving as that hub or that mechanism of being able to share information and improve communication among different agencies that exist in the community. I'm going to highlight in a minute this provision of cost-effective response to crime and really focusing on a reduction of the amount of time between arrest and intervention by expediting the processing, identifying needs that a youth and their families may have, providing connection to those services, and really kind of as soon as possible being able to intervene and support youth and families. Something very quickly, it's also really important to highlight, we say assessment centers. Assessment centers are in the name of our association. And there's a reason for that would, I'm happy to have a conversation about at another time. But really, these centers are diversion centers, prevention centers, resource centers, connection centers. Many communities name their centers different things. There's the Harbor in Las Vegas. There's the Front Porch in Georgia. I mean, these are community. The community itself comes up with names for the centers that really support the vision for creating this diversion, prevention, resource, and connection opportunity for youth and families. An assessment center or these resource centers can provide or serve this purpose before police contact. So do a lot of prevention work in that school, direct access for youth and families, hospitals. Many communities are using the assessment center, or a handful are using the assessment center model to really engage in that front end violence prevention work. It can happen when there has been law enforcement contact, but no citation issued for status offenses, family conflict, things that might happen at schools. So SRO involvement can happen after law enforcement contact, or certainly much further down the line when there has been law enforcement contact or youth has been detained. How a community structures their assessment center is really based on this comprehensive intervention mapping process and looking at where do we really need to situate our single point of access or a single point of contact in order to best serve both the community and their families. This is just, this map is actually about a year old at this point. You can see where assessment centers are across the United States. They're like Idaho, for example, is missing on this map, and they have through state funds over the last 18 months or so stood up about 10 assessment centers. So they're missing from the map, but this just gives you an idea of where across the United States these assessment centers are. I'm going to provide two very quick examples of assessment centers that are in many ways relevant to the conversation that has happened in Delaware County so far. The first is the Family Resource Center. This was created in 2017. This is in Ashtabula County, Ohio. And this assessment center was created as a separate entity from the courthouse, but it is a court-run or probation-run entity that operated from 8 a.m. to 7 p.m. Monday through Friday. In April of 2018, the county actually closed the Youth Detention Center and made the Family Resource Center the 24/7 point of contact for all youth who were coming into contact with law enforcement. So the Family Resource Center is the entry point for all youth in Ashtabula County, with the goal of getting youth and families connected to services as soon as possible, and really diverting from unnecessary court contact. These are some data that they highlight from 2011 to 2022 in terms of admissions to DYS or admissions to YDC. So the YDC is their youth detention, or now what they do is actually similar to what I think I heard earlier. They partner with local counties for the few youth that they detain every year. So you can see a significant decline beginning in 2017 or right after 2017 into 2018, when the Family Resource Center was implemented, a significant decline in the number of admissions to detention. Just a quick thank you to Andrew Miziak, who's the court administrator, who shared these data with me for today's presentation. This is the Multi-Agency Resource Center, which is in Calcasieu Parish, Louisiana. They operate very similarly. All youth who are going to be screened for detention or who have contact with law enforcement are seen and screened by the Multi-Agency Resource Center, or the MARC. They also operate and have expanded into prevention. So youth and families can access their services without any law enforcement contact, and schools can make referrals to the MARC without any law enforcement contact. Since 2011, they've served 13,461 youth. They have diverted 83% of all youth presented to their agency from formal processing, and they have been able to keep 26% from even having a light touch with the juvenile justice system in their community. And they really focus on, again, identifying what the needs are for youth and families and providing timely access to resources and services that currently exist in the community that the families might not be aware of or be able to access otherwise. Similarly, a thank you to Josh Campbell for these data. With that, I will stop presenting.
Yeah.
And go ahead, Annie.
Yeah, there's only one thing I would add. We formed a Juvenile Justice Leadership Council that includes Danielle Di Matteo from probation, Alyssa Poole from the Public Defender's Office, Katie McGee from the District Attorney's Office, Sandra Garrison from DHS, and obviously Dave Irizarry. And we've started having some conversations thanks to the resources of NAC giving us kind of a script to talk to school resource officers. We plan on talking to additional school personnel. We plan on talking to law enforcement, sort of getting a sense from them based on the children that they're coming in contact with, the families they're coming in contact with. What are they saying? What do they think we need? And how can we partner with them in very different ways to prevent kids from getting to the attention of the juvenile court? And so that process has gone very well. We're going to continue to have those kinds of interviews, but that is going to be work that NAC supports in a much deeper way as we focus on those 5 communities. So if you have specific questions about what that looks like, Carly has led those efforts in many ways. The only other thing I wanted to add, I know that Dave had presented some materials to the Board of Managers, and there were some questions about what Philadelphia has done. It's a bit of a long story, but Philadelphia has been consulting with NAC for a couple of years now. The initial plan was very consistent with what we're doing, which is kind of looking at the data, looking at the communities, and trying to put different, and again, the use of the term assessment center could be misleading because it really depends on what the community decides to come up with. They ended up only using one assessment center that is up and running. Dave actually just went last week to look there. It's called the JAC, the Juvenile Assessment Center. It is where all kids are being processed, but it is a very different model that's not necessarily consistent with the framework of NAC. And I think there might be some changes to that as things move forward based on the new administration. Kevin Bethel, who's now the new police commissioner in Philadelphia, I know has some questions and knows Carly very well from a long time ago. And she did some of the evaluation of the great work that he did with school diversion in Philadelphia. So I think that model is evolving. There may be some other opportunities to learn from that, but that's not necessarily the direction that we have envisioned going with the partnership with NAC. So I know there are questions about that. We can answer them to the extent that that's relevant. But I don't think that that's the direction that we expect to move in at this point. So Dave, is there anything else that you wanted Carly to specifically speak to? Are there any questions?
No, Annie, at this point, I want to open it up to the board to see if they have any more specific questions.
Well, I have a couple. I mean, I'm really trying to envision how this would work here. And just some really basic questions like, are these brick and mortar? Are they 24/7? Is a child we're intervening with, does that child go there before getting into the justice system? And then can they stay there? Can they sleep there? Like, can you just explain a little bit more what it would how it would play out?
Yeah, they look different in different communities. So the process that we're proposing is actually to really facilitate Delaware County with using the data that you have and identifying what the best fit is. Many are brick and mortar, some are co-located, some offer mobile services. There are a couple of assessment centers across the country that also offer crisis respite. So once the data really point to what model would be most useful to Delaware County, that's where we can also connect you with or connect Delaware County Planning Group with the communities that have implemented a model that looks like what you're moving towards.
Yeah, and just to add to that, Councilwoman Schaefer, I think that this is not at this point envisioned as an alternative to secure detention. It is an attempt to create pathways to prevention and pathways away from the juvenile justice system. I think in other places and the things that we've been most interested in is co-location with existing community-based services that families feel comfortable going to. And so we don't envision having to build a new center in each of these 5 areas, but really partnering with community in a very creative way based on the relationships that we're able to build throughout the mapping process.
Just to, I guess, to follow on to Councilwoman Schaefer's question, and it's kind of where I'm going as well. I'm just trying to understand how going from where and how things work currently to what this model might be. The part that I'm trying to get my head around is really the triage point, and who is involved in the decision making around that triage, and whether youth is diverted into something that's not detention related. How does that decision-making process, how might that work in terms of working in partnership with, it helped me with a little bit of understanding, like how that sort of jives with the juvenile court and probation services that already obviously have a big say in all this.
Yeah, I'll speak globally, and then Annie, please, if there have been conversations locally, add in. That all happens as part of the planning process. So there is agreement in terms of which charges, which young people will be diverted to the assessment center, and which ones will remain in whatever process you currently have in place. So this is all part of the planning process, and there are agreements, and it's set in policies and agreements between different entities. This very often includes schools, law enforcement, and certainly probation and courts, so that everyone is in agreement in terms of, again, how this assessment center is going to best serve the community and the community identified needs.
And I'd imagine it's a malleable model, right? Where you may start off with an understanding with courts as to what circumstances, who might be picking up the phone and calling. Is it a school administrator, or is it a police officer? And again, under what current circumstances the youth might be in. This is what we've agreed to with the courts as to when the call would go to this center, whatever type of center we're calling it. And then it can evolve over time, right? Is that kind of the idea, that it could be sort of, you start this off in sort of a pilot way, and the model evolves depending on how we're seeing it work in Delaware County. Is that a fair way of putting it?
That's a very fair way of putting it. Absolutely.
So and Chair Madden, I think the only thing I would add to that is that what you're saying is exactly right. There are memorandums of understanding amongst all of the stakeholders that we've referenced, including the court, who's a big stakeholder here. There have been some jurisdictions, I think Georgia is one of them, who their assessment center handles all misdemeanor cases. They don't even go to the court. And so I'm not sure that's the point where we're at, but that is a discussion point for us. But it's really about having those memorandums of understanding about which cases will be initially diverted and won't even come to the attention of either law enforcement or the juvenile court because of the nature of that offense, the status offenses, the situations that occur in school, a fight in school. And a lot of what we heard from the school resource officers is, and from the district attorney, in fact, is getting those kinds of calls isn't necessarily helpful to either solving the problem or providing a current systemic solution. And so how do we work with community in different ways? A huge thing that came up with a great example of some restorative justice practices that are occurring in Aston right now that we might want to replicate. Some really great community service that the school resource officers are doing in some areas of Delaware County. That again, how do we replicate that? How do we support those kinds of community-based alternatives instead of, in some ways, wasting resources of the system that ultimately don't necessarily provide a solution to the problem that the child is experiencing in that moment, but create productive opportunities for their advancement and their positive impact on society.
And so presumably at the outset, given the work that's been done thus far in evaluating the needs in Delaware County and the existing resources in Delaware County, there would be a proposal made to Delaware County about what you think the model might look like here. Obviously, you know, requiring buy-in from all the stakeholders, but with regards to what you see, what are the needs? Is there a brick and mortar need? Is it sort of at the start, a few people in a, you know, in an office who's more sort of taking on this responsibility based on what calls would be going into the center? I guess you would give a more thorough proposal to Delaware County before we sort of, you know, put anything into an MOU that gets discussed with the courts. Is that right?
Yeah, so Carly can speak to this, what's happened in other places, but I envision this grant being a planning opportunity with the National Assessment Center, where once we do that sort of deep work in those 5 communities where most of the kids are coming from, we present something to this board and say, here are the findings. And it may look very different in each of the areas. There may be a community provider that steps out that has some space and it's the perfect hub that young people and community feel safe going to. And that could be the solution in Upper Darby. There may be a different solution that we recommend based on conversations with the community in some of the other areas that we're going to dig deep into. And so this request from the board today is for this planning process, for NAC to assist us in working it deeply in each of those communities to come up with recommendations for each of the hubs of service delivery that we propose.
Yeah, that is the plan. In addition to providing recommendations, it's also providing the a template basically of an operational plan and the resources, pulling from similar assessment centers that you would need, you know, just in terms of like, what would a memorandum of agreement look like, screening instruments, like what would you need to actually implement what the community has identified as the need.
Other board member questions, comments?
Shakima has a question.
I have one question. And as you undergo the planning process, is one of the byproducts of the planning also identifying and uplifting effective practices that are worth porting, scaling? I'm just kind of curious about, in addition to what the community inputs, are we going to have an opportunity to learn what things are really working well?
Yeah, I would lean on Carly for her expertise and then I'll chime in.
Just a point of clarification, are you saying best practices or what works well from within the community or more globally?
What works well locally from the community? Like you're going, I don't know. I'm not sure I'm fully understanding the first phase of this. I understand that there's resources, you take people through a planning process, but in the discovery of the information, I'm hearing that we will get recommendations, but I didn't hear that if we find like promising practices or effective practices, that those would be sort of called together and uplifted as well. And that's what I'm asking.
Yes, they are, in so much as a significant portion of this work is conversation with community, with families, with agencies, with others who are doing work in this space. As Annie mentioned before, talking with schools and SROs or community resource agencies that are serving youth and families. And a big part of those conversations is what are you actually providing or how are you engaging with youth and families to identify what some of the best practices, promising practices are that are happening or the innovations that are happening. So that's a very qualitative identification. You know, we're not doing an evaluation of outcomes in that way, but we are certainly identifying where there's promising practices that are happening in the community.
Yeah, and Shamika, I think that's an excellent question. And the example that I gave about the restorative justice work that Aston is doing, that actually came from a training that was offered by PCCD, but not every community knows that that's available. And so just knowing that that's working in Aston and making that training available through the support of PCCD to the other communities that we're working with, I think is what we want to spread. So it's talking to people who are effectively working positively with young people and replicating those practices in other areas in Delaware County. It's not a huge investment in money. It's really about tapping into resources that currently exist in the Commonwealth and making sure that they're available in Delaware County. So as we listen to community about things that we might not have known that aren't currently funded under the needs-based plan and budget in Delaware County, how can we reinvest in things that sort of pop up from community as places where kids would want to go? Because even when we did our listening sessions with young people, we heard them talk about things that they would want to be doing that don't currently exist in rec centers. And so where they might exist in the community and how we build those things up and uplift them in ways that make them accessible to more young people is what we hope to get out of this process.
Thank you.
So, and also just additionally, there, and I'm saying additional layer, not a different layer, but there also is going to be an additional layer of best practices across the state or across the country that go along with this also, right? Because we only know what we know and we do the best with what we have, but it doesn't mean it's the best for our young people moving forward. So I just want to make sure that piece is part of this too.
Yeah, Reverend Turner, I think that was a piece of the assessment, right? Is that there are many other practices that are nationally used that we don't currently use in Delaware County. And that's, I think, a tremendous opportunity for us to kind of tap into what's happening nationally. I will say that I think at some point, Stoneleigh, if we find an assessment center that has many of the same characteristics of what's happening in Delaware County and we need to do a visit, I'm hopeful that I could try to get Stoneleigh to support that kind of visit. Peer-to-peer learning is often incredibly helpful. Talking to the people that have implemented something that could potentially work and adapt to what's happening in Delaware County is incredibly valuable. And how we really learn from other people who have implemented something similar. We always know that it has to be specific to our communities, to our young people, to our families, but learning from others and not reinventing the wheel is something that we hope to use through the expertise and the experience of NAP.
Thank you.
Before I ask the board to move forward with a vote, I just want to establish a few things. I think first and foremost, we have a district attorney who's told us collectively, certain juvenile offenses he does not want to cross his desk, right? So we've studied Delaware County in the past couple years, and we saw that 85% of the kids in the system were low-level offenses, right? I think it's our duty to be able to provide a resource for our lead law enforcement officer to be able to do so, right? If he's saying he wants to divert these cases, if they're bought in, I think we have to find an entity to be able to do so. Just as well, for those higher level offenses, we have to provide secure space to our juvenile courts. But we also, as we talk to community, they don't necessarily have a community hub, a space where they can be in real time connected to resources, whether it's a mom, whether it's, a school resource officer. We also have to provide that resource for community as well. I think NAC has the ability to do all of these things. It's our job to establish what that looks like operationally in our planning process. And the proposal that we brought forward is to hopefully be able to do so.
I'm not sure who this is directed at, but I guess I have two funding questions. And I guess they're separate questions, but the first is with regards to the continuation of services here. Can you just speak to, from a funding perspective, what we have to understand there? And then separately, with regards to a center, how does that model work from a funding perspective? Does this get reimbursed by the state formulaically up to a certain percentage? What do we know in terms of how that works?
Well, so again, I'm very fortunate to be placed under Chief Sandy Garrison. And with that being said, I think any community-based program will be included in our countywide needs-based budget. Community program is reimbursed from the state at 80 percentile, right? So 20% eventually would be our cost. We would have to obviously pay for things up front. And at that point, we have the opportunity to be reimbursed at the 80 percentile. A while ago, we met with the state, and I talked about neighborhood resource centers. I talked about using some of the funding that was traditionally placed in detention, and during our idle period, being able to reuse that for community-based alternatives. So if you actually go back and look at our countywide needs-based budget plan of last year, I talked about neighborhood resource centers, and essentially, this is something that we hope to launch in Delaware County. So again, as it relates to detention, it's cheaper, and then as it relates to data and evidence-based practices, it's more effective. Again, we're very fortunate to have Anne-Marie Ambrose aboard, and she developed a cool model in Philadelphia in which they've established, they assess existing community-based spaces and programmatically, contractually built out additional spaces within. I think for me, that's a long-term vision for me here in Delaware County as it relates to these centers, right? There may be already brick and mortar established. It's just bringing, contracting several community-based providers to work together and, utilize our existing resources.
And Dave, just to clarify the point, when you say cheaper, that's because the reimbursement rate for detention is 50 cents on the dollar versus the 80% on the dollar that we're talking about here.
Yep. Secure detention is only reimbursed at the 50 percentile. Anything community-based, 80%, and if it's a promise and practice, and obviously it can be a bit higher. So, at the minimum, 20% would be on our local taxpayers.
And then in terms of the continuation of services for the assessment, can you speak about that, the cost?
So again, any of the services that our NAC would be referring young people to would.
I'm sorry, I just mean this upfront work. The assessment, I guess, is dually used here. But
again, I'm looking at our chief. I believe again that this planning process also can be included within our needs-based budget. As of now, we do have the funding in our general budget to be able to do so, and it would be paid as of now through my budget. Our budget, and then have potentially be reimbursed through our Act 148 funding.
Okay, but there is no more outside grant funding at this point for this. This would now be going into the reimbursable.
Currently, it would go into our general fund. Again, we can continue to pursue grant funding. I think there's going to be another round of federal funding that, again, we were kind of informally told that we have, we're aligned with. So, as that presents itself again, we'll apply for it. And, our federal grant that we applied for had this planning process included. We just missed the mark. Philadelphia and Harrisburg's PCCD received that funding. And again, Anne Marie kind of mentioned that they have a lot of interest in Delaware County as it relates to potentially using their grant because we're aligned with what the state wants to do and what a lot of the nation wants to do. So as of now, the short answer is, it comes out of our general funding, but there's potential to have some grant funding to reimburse what we're doing.
And do we have a sense for price tag?
So the proposal in terms of this planning process was $60,000.
Okay.
Can we just revisit Shakima's question one more time? Because I'm not sure I really followed the answer. This is a system for connecting youth who are at risk with resources in real time, resources that already exist. But it's been my impression from going out into the community with all of those meetings and from talking to the people who are working in our justice system that those resources don't always exist.
Mm-hmm.
Like right now, we don't have enough and we don't have the right things. And so that identifying, I'm taking it this planning process is going to identify what we would want in place. But how does that happen?
Yeah, so again, I think what we will learn this process is there are some programmatic pieces missing, right? And
Right.
again, I'm going to lean on our Chief Sandy Garrison in terms of allowing us when we establish that piece, right? Being able to create an RFP, bring it before you all, let's agree upon it. We'll have the data backing the need. And again, put it out for bid and hopefully get some folks who are able to do so.
Mhm.
I don't think we have all the programs that kids are going to need right away. But again, throughout this process, I do believe we'll establish that. A lot of our baseline assessment already established that, right? And there are a few initiatives that we want to lay out coming out of our department to be able to suffice for some of that. But yeah, I don't think there's going to be, in the planning process, it is what it is, the planning process, right? We may identify that there are going to be some more programmatic components that we have to add to the program, but as we identify that, I'm more than welcome to, memorialize that here, express it. Hopefully we all get on board, bring it before council, and be able to bring those entities to the county. I think in terms of process, the way it works, and again, once our district attorney is at the table and establishes what youth offenses that he essentially doesn't want to see before him, as a local law enforcement makes that arrest, there's still that process of what community may perceive as accountability, right? Maybe now instead of being taken to our juvenile courts, they're dropped off at this community center. And at that point in time, the assessment starts and they're connecting them to the resources as it relates to what they've identified as some issues in their personal lives, things of that nature. And they'll be diverted outside the system, but still getting the services they need. We can study that and see if those young people are recidivating at any point. But as you can see, Ms. Keeter expressed a lot of data around, well over 70 up to 80% of the kids who are brought to an assessment center likely are not recidivating.
So what I'm hearing is the upfront work that's being done, a big part of that is identifying where the existing gaps are, right? Where we are missing services that one would want in Delaware County, and then either helping the county to put out an RFP, I guess, yeah, for those services. Or if it's not, for some reason, if the view is that we need to stand that up ourselves, that we can go forward with an understanding of what the county would need to do.
Correct. And I think we also have a good understanding of what the county currently funds, right? But there are community-based organizations out there that exist that we may not fund. Through this process, we may find out that there's an entity that the community relates to, right, that finds to be effective, right? And I think we as the governing body can try to scale up, right? Figure out ways that they need more support and maybe contract them. I think, not really related to this, but kind of, our juvenile justice planning team, that's what we're working on now, trying to figure out who are community leaders in our 5 areas, right? What do they need in order to be able to take on more of this work, right? We took one of our community partners to Houston with us, and we thought that he and his organization had the capacity to take on more, right? But you only represent one part of the county, right? We have to find essentially 5 or 6 more of you, and I think as we establish this need, we have to make sure we have to do our due diligence and make sure that we're building these folks up as well to be able to take on more, right? We can't just drop a load on their shoulders. We have to train them. We have to figure out what their capacity is, what are some of their limitations, and train them to be able to do so.
Other board member questions or comments? Okay, hearing none, I would entertain a motion to approve support for the continuation of services by the National Assessment Center Association.
So moved.
Second.
So we have a motion and a second. Any further questions or comments? And again, this would be a recommendation by this board for a contract that would then go before county council.
Excited to have them on board. I'm looking forward to this process and the assessment process and the work that they're going to be able to do, because I do believe it's going to have a really big impact long term, especially when we're able to move from the who's triaging with the courts and the DAs to the point of our schools are utilizing them before they even come into contact with the courts or the system. And so that's really where we want to get to. And so I think that we have the potential to really make a big impact here. So I'm looking forward to it coming on board.
Yeah, I agree. I think it's well overdue and just about the right time to do exactly what they're talking about. And I'm excited to find out what we don't have. Yeah, what's not in the cabinet so that we can get it in there and do what we got to do. So this is great.
All right, if nothing further, all in favor?
Aye.
Aye.
Any opposed? The ayes have it. All right, thank you. Mr. Azari, anything else for today?
I just want to add, again, a couple meetings ago, you all approved us to be able to advertise a community-based detention space. We look forward to bringing that before council April 30th this month, and hopefully we're able to gain approval and be able to pilot that as well. So this would be another tool that Delaware County has in a least restrictive kind of setting, but still be able to be responsive to our partners in juvenile court when a young person may need to be removed from their community. So looking forward to that.
Dave, you're saying that that'll be ready to come before county council?
April 30th, correct.
Okay, wonderful. All right, well, my thanks to Anne Marie and Carly for your continued help here in Delaware County.
Thank you.
All right, moving on to any old business from council, from board members? Any other new business? If not, we can move on to our second and final round of public comment. Are there any members of the public who would like to address the board?
I would.
Yes, Kirsten.
I mean, as a resident taxpayer member of, my community here in Brookhaven, close to Aston, I know that you guys don't answer questions and, but I just wanted to put a few thoughts out there regarding the National Assessment Center. And I know that David talked a lot about the funding and that it comes from the juvenile detention and rehabilitation budget. I guess my question is concerning, like, if you build an assessment center, who are we then employing people to be there 24/7? Are those people employees of the county? Are they employees of the courts? Since we're trying to divert kids from the courts, does that mean we're bringing on new salaries and benefits for those employees? Are we looking to partner with the ones, obviously we're looking to partner with those resources that already exist, like child and family focus or child guidance resource centers. And have we discussed any of these opportunities with like, you know, people from like the Community Action Agency? Are we looking to have those people inside of the assessment center? I guess I just have questions regarding like, yeah, like who pays for all of this as a taxpayer, and does the budget then affect our detention budgeting, and does it affect our JPO budget as well, since they're supposed to be separate? Or is this all related to grant funding if it is considered best practices? Is it going to be overlapping to the court? Is JPO going to be able to send somebody to the assessment center, or do we just do our own assessments like we currently do with intake officers?
I appreciate the questions, and what I would offer up is I think those are all the sorts of questions that I myself would want answers to. And so I think as part of this, you know, this work that will go before council to be approved to do, I think the answers, I would suppose, are probably different depending on the jurisdiction that you're in and what exists here. So, you know, I think what we hear back from the National Assessment Center Association will be exactly that, to answer these sorts of questions. What would we be migrating from what we currently have? What would we be migrating to? How would that work?
And Kirsten, I'm willing to come down and meet with you. I mean, Chief DiMatteo has been at the table and is well aware of what we're attempting to do. But again, I'm willing to come down to probation and try to answer these a bit more intimately. You know, again, it's the planning process, so a lot of it at this point is all speculation. But again, I can reach out to Danielle and set some time up that we can talk about it.
Well, I appreciate that, but I am asking more general of a tax-paying constituent of this county. Like, you know, things cost money, so, you know, and taxes are going up, and, you know, just as a taxpayer, we want to know where our funds are going and if they're being put to good use and not replicating things that we're already doing, if that makes sense.
Yeah, look, as a council member and one of 5 who is tasked with ensuring we're being conscious fiscally with taxpayer dollars, you know, my mind really goes to that reimbursement rate. And if there are opportunities to move more dollars toward, aside from all of the reasons that one would do so for the interests of the youth that are in the system, from a taxpayer perspective, if we can move more dollars toward the 80% reimbursement and away from the 50% reimbursement, that's moving things in the right direction for you as a taxpayer.
Would agree that that is definitely beneficial. I guess it then comes to who's basically funding a national assessment center, and are those employees added to our local county council budget and things like that. So I do appreciate the back and forth, and I know that you don't have to answer questions, so I appreciate that as well. And I also know how hard it is sometimes to get some of these resources to come to the table. Just even giving, you know, Community Action Agency a call can sometimes not be helpful. So
I certainly, for my part, I certainly appreciate the questions, and you know, your office is a critical stakeholder as we work through what makes sense for Delaware County. So I hope you continue to ask such questions.
thank you. Thank you for answering.
All right. Any other public comment for today? Hearing none, we'll move on to any last board member comments for today. If none, I would entertain a motion to adjourn.
So moved.
Do we have a second?
No, yes.
I think we have a motion in a couple of seconds. All in favor?
Aye.
Aye.
Bye.
Any opposed? We are adjourned. Thank you all.